Good afternoon, everyone, and welcome to the HIV and breastfeeding webinar. I'm Destiny, the media strategist for Seeds of Healing. Seeds of Healing is an HIV awareness and advocacy organization whose mission is to deconstruct myths that perpetuate HIV stigma. Our work seeks to eliminate disparities for Black women living with HIV. This webinar is being recorded and will be shared on our SoTime platform and posted to our YouTube channel for you to share with others or come back to watch yourself. Attendees are able to drop questions in the chat box and will be shared at the end of the webinar, but these will not be anonymous. So if you wish to ask anonymous questions, please use the Q&A feature. Please feel free to ask questions and write comments throughout the entire program. Before the webinar begins, please welcome our panelists today. We have Ciarra Covin, who has been a survivor of HIV for more than a decade, diagnosed at the age of 20 in a small rural town in the southern region of the US. She's both professionally and personally committed to advancing the dialogue around HIV and breastfeeding. We have Olivia Rice, who is an IBCLC and community volunteer. She is a wife and mother of 3 homeschooled children. Originally from San Diego, California, she's been living in Wilmington for 10 years. Olivia enjoys sewing, cooking, and supporting the breastfeeding community. And our moderator today is our very own founder and executive director, Dr. LaShonda Wallace. Without further ado, I will turn it over to our panel.
Hello, welcome everyone. Well, today I want to say congratulations, and I just want to congratulate everyone for keeping hope, faith, and their commitment to not only yourself, but your family and your community with Seeds of Healing. And to the women with HIV who commonly share concerns about their maternal health needs, we thank you for being here today, and we want you to use all these pearls of wisdom for keeping yourself and your families healthy and secure. So there are misconceptions about a mother's likelihood of spreading HIV to their infant during breastfeeding as well as birth. But today we're going to discuss these facts, and we're going to deconstruct the myths that perpetuate HIV stigma. We're going to generate support for those who are living with a diagnosis of HIV, those who are affected by HIV, and help eliminate those disparities in HIV outcomes for women. In addition to our panelists' testimonials, information from various peer-reviewed journals and the World Health Organization was referenced for our discussion today. The World Health Organization current breastfeeding guidelines state that women with low HIV viral loads, due to consistent use of antiviral therapy, have a less than 1% chance of transmitting HIV to their infant. This percentage, of course, varies on several factors, and that include the frequency of taking your therapy consistently and access to HIV prevention resources. So there was a meta-analysis published in the Journal of International AIDS Society in 2017 that reviewed 11 different observational and experimental studies regarding a mother-to-infant HIV transmission. And the findings confirmed and were consistent with the World Health Organization advisory that states there is significant evidence supporting that postnatal HIV transmission is significantly reduced under maternal use of antiviral therapy. So, however, once these therapies are discontinued, there was a noted increase in exposure. So mothers diagnosed with HIV who are not receiving therapy were advised not to breastfeed and to use formula only. A study published in the Journal for the American Society of Microbiology took a step further to analyze the concentrations of various antiviral drugs in nursing infants as a result of breastfeeding. And so while this research is still widely underdeveloped, we emphasize the importance of discussing maternal needs and various antiviral types with one's provider during the individual's pregnancy to promote the best care possible. So women who are stable on therapy before conceiving are encouraged to work with their provider to integrate their care into their maternal health care. Receiving therapy for at least a year and being undetectable is considered a low risk of HIV transmission while breastfeeding. And women diagnosed with and initiating therapy during pregnancy will not be deemed clinically stable until the infant is at least 6 months old. But still, you are advised to consult with your medical provider during this time. So consistency with your doctor's visits and follow-ups are key to avoiding gaps in care and issues related to HIV transmission to the infant. So this webinar today is not to provide medical advice. Our panelists, including myself, are here to share insight into lived experience, reference peer-reviewed publications, and encourage our audience to seek their providers for shared decisions on healthcare matters. So without delay, I'm going to introduce again, Cece. So Cece, thank you for being here. Mentioned in your bio, you are also representing or a member of the Well Project. Before we get into some discussions, can you tell us a little bit about the Well Project?
Of course, of course. Thank you all so much for having me here today. As mentioned, my name is Ciarra Covin. I'm currently program manager for the Well Project, which is a nonprofit that serves women and girls across the gender spectrum who are living with HIV and those that are vulnerable to it. So in my work, I get to run many of our programs, including BIBA, which is our breastfeeding program, building equity, education, and ethics on breastfeeding and HIV. And since this implementation, I want to say like 2020, 2021, I don't know, all the years are running together, we have been able to lead a lot of change in the realm of breastfeeding and HIV, amongst other things. So I'm so excited to be here today to talk through all of these things.
Thank you. Thank you. Olivia, thank you for being here. One of the things that we did not mention or share, Olivia, in Wilmington, you are also our healthcare hero. A few years ago, you was recognized. You're also a leader of the Wilmington's Chocolate Milk Group. You are a strong advocate for Black women to breastfeed. Can you share with us before we begin our discussion, why is it so important to you that Black women are encouraged to breastfeed?
Hey everybody, I'm Olivia Rice. I am a co-founder of Chocolate Milk of Wilmington, along with lots of other titles I hold. But that is the most important one to me because I didn't really realize how much disparity and how much lack of support there was for Black women. And once I started delving in and meeting these women one-on-one through events that we had and whatnot, I started seeing it and talking to them, and there was nobody to help. There's lots of other groups that you can go to that tend to be all white women, and hearing their stories about not feeling welcome and not feeling like they spoke to them, and so they didn't go. So once I figured all that out, I was like, we need to start something else, and so we did, and we've been a thriving group for the last 4 or 5 years. So I'm really happy to be able to help whenever and wherever I can.
Thank you. Thank you for being here. Okay, so we're going to jump right in. And Cece, can you share with us what are the latest updates about breastfeeding and women who are diagnosed with HIV?
Oh yay, this year has been wonderful. It's been a long road to get here, I feel like, but it's been wonderful. So the Department of Health and Human Services, just as of January 31st of this year, updated their infant feeding guidelines for people who are living with HIV. And within that, it was specifically those infant feeding guidelines that now they have been updated with like great changes, such as the biggest one for me is the fact that Child Protective Services should not be a response to any parent who is living with HIV and who wants to breastfeed. They've now included like detailed information on the benefits of breastfeeding, which is something that has kind of been shied away from. I've learned as a woman living with HIV for almost 15 years now, both of my feeding experiences or birthing experiences have been while living with HIV. With my first child back in 2010, I had no conversation about feeding from my body, breastfeeding, because I was living with HIV. It was just assumed and known that I would be giving my baby formula. So now, there are benefits, even if that mother is living with HIV and wants to feed her child, there are still benefits that exist. So that being detailed out in the updates is phenomenal. The equity considerations to address effects of like structural racism and poverty and segregation. All you can hear that all up in the tone of these updates. And this very hugely is the first time that the guidelines does not say do not breastfeed if you're living with HIV. These are huge, and these changes would not have been made without the strong input of community voices such as mine, other advocates, and organizations such as the Well Project.
Thank you. Thank you so much. Just talking specifically about the benefits of breastfeeding and how it helps Black women in regards to reducing or eliminating the disparities in health outcomes that we deal with as a person of color.
Right.
And why it should be promoted, amongst us more.
Well, there's so many benefits to breastfeeding, such that, like I was saying, high cholesterol, high blood pressure, that type 2 diabetes, those are all things that Black people in general that we struggle with. And breastfeeding is a huge way to counter many of those health issues. Postpartum depression is a lesser issue for breastfeeding. And also, it seems like the Black community, and it not just seems, it is, that they're pressured into formula feeding, which causes disparities for the child. So it also helps to reduce lots of health issues with the child. And I mean, it also helps to promote bonding with the baby and less having lower income or having poverty. Like you don't have to worry about so much of the cost. There is a cost that comes with breastfeeding, even though it's not possibly monetary, but it just helps with so much, and in both health-wise and psychologically. So it's really important, especially for the Black community, to breastfeed. And since it hasn't been promoted as much as it should have been, it's important for us to take back that natural way to feed our baby and give them the best possible start to their lives.
Thank you for bringing in the point about it's not just about the monetary benefit of breastfeeding, but also the impact that it have on psychological. So there are several layers to consider, and switching that over to Cece, having to deal with a chronic ailment already come with layers. And then now to be a mother and having to have the concern with also protecting the health of your baby. I'm pretty sure that, as what Olivia mentioned, consideration of postpartum concerns with depression and behavioral health, that definitely possibly would have been or can be a consideration as well.
Oh, yes. And we're talking like not just any ailment or illness, is HIV, which is so heavily stigmatized. And so what we have learned is that the risk of transmission is very low. Thank you for talking through that in the beginning and kind of setting the stage. It's less than 1% if the the mother is undetectable and she's engaged in treatment, please ask your providers. But that 1% risk of transmission is why breastfeeding was taken off the table for so many mothers who are giving birth, that 1%. And I tried to frame this in my brain so many different ways. When I was leaving the hospital from that second birth, they gave me birth control. And both of the doctors who walked in were excited to tell me that the risk of me getting pregnant was 99%. Like, it was 99% effective, this birth control. But yay, 99%. But isn't that the same thing you're saying when there's a risk of 1%, of me passing this to my baby? But because of the HIV stigma that we are unfortunately faced with on a daily, in so many ways, people try to take our autonomy because of this diagnosis, which should not happen. And as Olivia has spoken, those benefits, that bonding, my first child, I felt useless. Like, I felt like my body was good enough to birth a baby, to carry it and do all of these things. But once it got here, my job was done because of my HIV status. Anybody could get a baby a bottle. He was bonding with them as he was bonding with me. I felt useless. So that I can personally relate to that postpartum, this depression. Oh, that was so strong. So I fought for that this time. I fought not to have to be faced with that. And I noticed such a difference. Like, my baby was fine. My baby loved me because I made sure that I considered, not just myself, but also the long-term implications that this can have for my baby. Because I love her is why I fed her from my body.
So Cece, so from my understanding, you've breastfed already, am I correct?
Yes.
So they just now updated the guidelines. How did you come to the decision to be proactive, to breastfeed? How did you come to that determination? How was that decision made?
So Zuri Burry was born in September of 2021. The guidelines didn't get updated until January 2023. So this was at a time where conversations were happening. I was seeing people in different parts of the world do this. But in one talk, it was that changed my life. It was talking, I was on a panel with a woman from Kenya, brown like me, pretty like me, we look like we could be sisters. And in Kenya, her question from her provider was, how long are you going to breastfeed? And I could not understand, we look alike, we just in two different parts of the world. How come she got that question of how long are you going to breastfeed? But here in the United States, they're telling me I can't breastfeed at all. What is the difference? And then watching the white girls navigate this space, the white girls had been able to get the green light to go ahead. I knew a girl in Virginia, Heather O'Connor, who her provider came to her and said, how are you going to feed your baby? Like, whoa, what do I need to get a little piece of that? Because clearly, urban Black Cece wasn't getting that experience. I was faced with the CPS conversation within 6 weeks of me being pregnant, and you don't even know if this baby is going to stick yet or not. And all I did was ask the question, and you're like, whoa, whoa, whoa. No doctor in America will work with you if that is your desire. It was my proximity to resources, that privilege, that I knew that it was happening. I just needed to get my hands on it. And I was able to. I had to let a doctor go. I had to hook up with a couple new ones, and just trust the process and really lean on community during that time. I wouldn't have been able to do it any other way.
Thank you. Olivia, I know you are used to this question because we've had this conversation a few years ago about how long should babies be breastfed. What are your thoughts on this topic, or what are your lessons learned about that discussion?
Well, baby should be breastfed as long as the mother and the child have interest in it. It's individual to every single dyad. It's not one size fits all. Of course, there is the recommendation to breastfeed until the child is 2, and until you want to afterwards. But honestly, I say that every drop of milk counts, whether it's one feed, you nurse until they're 6 months, 2 years. If you're crazy like me, 5.5. So it's really a personal choice. And if you do want to, breastfeed just for the first week or whatever, I personally will support you no matter what your goals are. I'm not here to judge you. You are the expert on your baby, and you know yourself. And that is what is important. That's what's your choice. So I would say, 2 is great. But with one feeding just to get their gastrointestinal tract like blind, that is amazing. Just a colostrum, whatever. So like I said, it's individual and a personal choice.
Thank you. I'm going to ask this next question, and either one of you can answer, and then we're going to get the audience engaged and we're going to do a poll. So I'm going to ask this question. During COVID-19, during the pandemic, there was a national shortage of formula milk for babies. And do you know what the impact shortage of baby milk formula had on the families? Cece, you can talk if you're familiar with what impact did that have on families living with HIV. In general, you may respond, Olivia, to families in general. And did this influence the importance of actually promoting breastfeeding in either situation?
That was a crazy time. It really was, especially on social media, seeing all the things that popped up, and that was really tough for me to see all that. But many families were struggling and they were stressing. They were wondering if they'd be able to feed their babies, especially if they used a specialized formula that was hard to find. And it was a miserable time. You would see people saying stuff like, oh, just breastfeed your baby, or them shaming mothers for not breastfeeding their babies to begin with. And to me, it's dangerous to say something like just breastfeed, especially when you are not currently doing that. It takes a lot of time, a lot of support to do something like relactate. And yeah, breastfeeding is important. It should be protected and promoted and supported. However, families got to do the best with what the information they have at the time. So maybe they didn't get the support to breastfeed. You don't know their backstory. So for social media, that was tough for me to see over and over again. But in some ways, yeah, it did influence, and by showing how something so basic a need as baby formula, baby food, can be taken away so quickly, and that there's no resources in place to lighten the load for those families. But on the positive side, it also showed how families and mothers can come together and they donate milk to support each other's children and babies through a great time of need. And I saw that over and over again. So there was a lot of positives and a lot of negatives that came out of that situation.
In all honesty, I was like, aha, not the fact that we was out of formula, but it was the fact that it was proven what I personally have been saying. The reason why we had not signed on, or that recommendations have been no, although we have research, is because the research was in lower resource settings. So the United States and Canada are considered to be higher resource settings because we always have access to clean water and we always have access to formula. And I was like, no, do y'all not know of Jackson, Mississippi? And do y'all not know of Flint, Michigan? We just had a scare here in Philadelphia a couple weeks ago. And it was like, no, we do not always have these things. There's a large assumption, that means you're not really in connection with the people that you're serving, because those are not always true for all folks. So with the shortage, I was still in the middle of breastfeeding, and I just felt safe. I was like, that was confirmation that I had made the right decision for me and my baby. It was like, my breast milk right now is the safest thing I could be giving her. I'm so grateful that I made this decision. What if I weren't? Oh, but the implication is that for the entire community is like, well, you listen to us now. That I'm doing everything else that y'all are telling me to. I've reached this state of undetectable. And it should be my decision. Don't force me into a situation that I didn't ex. Don't force it. Let me make my choice, and anything that comes after that's something that's based off of my decision, not your decision for my life.
Thank you. We're going to do the poll. And we're going to engage the audience to answer these questions. We'll give you about 3 minutes to answer the questions, and then we will discuss the questions. There's no wrong or right answer. We just want to know what your thoughts are, if the questions are a myth or a fact. So the first question is, formula has more vitamins than breast milk. Is this a myth or a fact? The second question is, African American women today don't need to breastfeed. The second question is, formula feeding is easier than breastfeeding. The fourth question is, breastfeeding makes your breasts sag. And fifth question, if your breasts are too small, you can't breastfeed. The sixth question is, you won't be able to make enough milk. The seventh question is, your milk will turn sour or dry up. That's if you don't breastfeed. And then eighth question is, breastfeeding spoils your child. The ninth question is, breastfeeding hurts. And the 10th question is, breastfeeding is cheaper. Formula feeding is cheaper than breastfeeding. So hopefully the poll was launched and people have been able to answer those questions. You should be able to.
I just want to say thank you for asking these questions, because these are some of the most basic questions that I get over and over and over again. And it's really nice to have a poll just to address everything, right off the bat.
All right.
To see some of the answers, because I don't know how to answer.
All right, so so you don't know these? Okay, so these are some good, okay, well, glad to know. So number one, formula has more vitamins than breast milk. So we're gonna pitch it to Olivia.
Their formula companies would lead you to believe and love you to believe that they have more vitamins. But it's definitely breast milk. Not only do they have vitamins, but it has all kinds of live organisms that help the baby grow and thrive. And not only that, but your breast milk changes from hour to hour, day to day, year to year, to suit your baby's exact needs. It tailor makes the breast milk for your baby. Formula milk, it doesn't do that. It's the same for every single baby. And one big thing that formula has, breast milk has that formula doesn't, is stem cells. So they can go and heal, different parts of the body, unlike formula.
Thank you for that knowledge. African American women today don't need to breastfeed. Myth or fact? I think we've covered that already, but just in case someone joined us afterwards, Olivia, you want to sum up that answer for us again?
Everyone needs to breastfeed. in my personal opinion. Not everyone, obviously. There's those who cannot and choose not to for whatever reason. But if you can breastfeed, it gives your baby the best possible start to life, whether you're Black, white, Asian, purple. It's the best for babies. It may not be the best for the woman, but it's always the best for the baby.
Thank you. Formula feeding is easier than breastfeeding. 25% of the people said fact, and 75% of participants said myth. So, Cece, you quiet over there. What do you've done both? So, what do you think?
There are so many things to be considered, and what does easier mean? As a woman living with HIV to breastfeed, the recommendation is pure breast milk only for 6 months. That was hard. That was very, very hard. Formula was hard too, because that came with some psychological things that I had to deal with for the reasons why I couldn't breastfeed. So I think that answer can be answered, per person.
Yeah, it's individual. I've tried both, and I'll say that breastfeeding was very challenging. Of course, I did not have an Olivia Rice in my life, but that's why we're here today, because we know that there are the benefits to having support, and I think that would have made a great difference. Yep. So breastfeeding makes the breast sag. Myth or fact? 88% of the people say that that's a myth.
That's a myth.
Olivia has 3 children that she's breastfed, and she already told us that she's breastfed for many years. So tell us your lived experience
about that. Well, the science behind it is that pregnancy makes your breast sag, not breastfeeding. That's the science. So however long you do it for, the baby tugs on. That's not what's going to affect it. What's going to affect it is all your hormones changing during pregnancy. So breastfeed or not, your breasts are going to look the same.
Wow, thank you. If your breasts are too small, you can't breastfeed. Myth or fact?
I can say from personal experience that is not true. That was literally one of my fears. I thought that I wouldn't have enough, but you still produce milk and the baby still can latch on.
So it doesn't matter if you're part of the itty bitty titty committee, you can still breastfeed. Okay. All right. Okay. So that's good to know. All right. So number 6, you won't be able to make enough milk. Is that myth or fact?
That is also depends on lots of things. There are very few reasons why a woman would not be able to make enough milk for her baby. Like insufficient glandular tissue due to breast augmentation or genetics, things like that could cause issues. But overall, we're made to make milk. We have been thriving on mother's milk for centuries and thousands of years, or however long we've been around. So we can make enough milk for our babies. Another thing that can affect that is how often you feed your baby. If you're feeding them on cue, if you're feeding them, if you're on schedule, those types of things can affect how much milk you are making. But overall, for 95% of the time, you can make enough milk for your babies, especially if you have support and are consoled properly.
Okay. Your milk will turn sour or dry up. Under what circumstances would that be relevant?
Sour?
Yes.
The older the baby gets, the saltier the milk gets. I don't know about sour.
Really?
Perhaps if you pump milk and leave it out for too long or something like that. But as far as drying up, again, breast milk is supply and demand. So if you're feeding your baby adequately, you should not be drying up. I mean, I nursed very infrequently for a long time and my milk changed so much. But I also have friends who have not breastfed for 4 years and still have milk coming out of them, not in large quantities, but they still have milk in their breasts. So.
Breastfeeding spoils the child. Myth, fact?
Both my kids spoiled and they both had different feeding experiences. So I don't think it's that. And spoiled, they're well loved, okay? Well
You're well
loved.
off. Okay. Breastfeeding hurts. Does it hurt, Cece?
I've not having a lactation support that I could have probably used. I think that I did a lot of things to myself that were hurtful, like letting the breast get too full and down there engorged, or not letting the baby latch right. So it did hurt for me at some times because I may have been doing it incorrectly.
And that's normal. It's okay. It's normal for it to be a little uncomfortable in the beginning, but knowing when to seek support when it is when it is painful, and if the pain keeps going on for a long time, and getting proper support. It's really boils down to support and having information about breastfeeding before you do it. It was really helpful.
Okay, and the last one is formula feeding is cheaper than breastfeeding, less expensive than breastfeeding.
I say for money, yes, it tends to be cheaper unless you have, in the long run, unless you have to have lactation support over and over and over and you're paying out of pocket. Luckily, a lot of insurance covers it now. But the expense of the time and having to sit there and your feelings about it's in your people's thoughts from who are coming into your space. That cost may not be it may be expensive in some ways, and it's not always monetary. But having to stay home or pump or ask your work for space and time to pump, or all these things are calculated into this cost of breastfeeding, and then the cost of formula, and it's a really tricky spot. So
Did you have anything to add, Cece, with that one?
I would just mimic exactly what Olivia said. What
Okay.
is the cost?
Okay. We have two resources we want to share with the audience, and then we're going to go to a Q&A that we have from our audience. And one of the resources is, do you need help breastfeeding? You can actually enter your zip code into www.zipmilk.org. And the other one is, Every Woman's Journey to Motherhood is Different. And that website is womenshealth.gov/it's only natural. And of course, we have our very own Port City Breastfeeding Project, which is at portcitybreastfeedingproject.org/breastfeeding-support. And now we will go to the Q&A. And the link to the Well Project, I don't see the link, but as soon as we have it, we will share it.
The Well Project's link is the bit.ly. So bit.ly/BEBA, BEE is 3 E's, BAH. So it should be
All
right.
right.
Thank you.
All right. Say it one more time, CC.
So it's bit.ly/BEBA, BEEEBAH.
There, you heard it right there from CC.
Yes.
Thank you. All right. So the first attendee said, thank you for mentioning the pressure for formula feeding. Can you expand on who is pressuring the Black community to formula feed and why?
I mean, I'll jump in first if you. So a lot of the pressure that I received was from the providers first, because I'm coming to them from an infectious disease space. So, because that is the safest state for the baby, and specifically it was pediatrics, the baby is at the forefront of, all that they care, that's their job. And why would a mother want to expose their child any more than what they've been exposed up until this point. So there was a lot of pressure. This is the only thing that we can say is 0%. A lot of pressure there. Or then that breastfeeding while living with HIV came with stricter rules too, because we don't have as much research as we need and would like to fully get the support from those who we need the support from. You know, the not mixing formula with food and living, being a Black woman with Black grandparents and Black folks around me all the time. We start introducing food, whether or not it's the right thing to do, but get that baby some cornbread, get that baby some of this other stuff. And I couldn't do any of that. And my family just couldn't understand why I was going against, these cultural norms or things that we had done. And I, at the same time, was trying to battle, what I knew I needed to do from what I've been told by my providers. So the pressures just never stop ending. There's always input that you're going to receive in their formula feeding, but then it would have been different, if I chose not to breastfeed, then, why aren't you breastfeeding? Why didn't you? The pressure is forever.
Yeah. I know personally that sometimes, as a Black woman, I know specifically that we carry the Superwoman syndrome, right? And our sisters, our mothers, our aunts, and those around us that can identify with what we carry on our shoulders can say to us that, you know, you can put that baby down and get that baby a bottle. Not in a sense to think or have the forward knowledge of understanding the benefits to breastfeeding, but knowing the world that we're trying to save and thinking that the bottle is maybe a shortcut to getting to the other responsibilities and tasks that we have on hand, but not understanding the benefits to the breastfeeding. So that is one thing to keep in mind. All right. And the other question was for resources in which were shared. Okay, so we're going to get back to some more discussion. Cece, did your health provider counsel you on the chances of the fetus contracting or the transmission of HIV? Like, how deep was that discussion and how did it make you feel, or did it make you ambivalent or hesitant about your decisions to have children or to breastfeed?
So living with HIV since 2008, a lot has happened, a lot has happened in that a length of time. With the first child, there was still, I think I was saying like a 2% chance of me transmitting to someone else sexually. But when I gave birth to the baby, I didn't have to have the C-section like I thought I was going to have, old rules and all of that. So I had a provider at that time, even in 2008, who's like, no, you can give birth to this baby vaginally, and the risk is this. Jump forward to 2021, we're in an era of U equals U, undetectable equals untransmittable. So if a person is on undetectable, they're unable to transmit the virus sexually. So even in that context, the messaging was a little different from the providers, but there's just still seemed to be some boundaries that some were not willing to cross. So if I would have not advocated for myself and stayed with that first provider that I was with and that I had a relationship with for a decade, then my experience would have been extremely different. So once I got into a space with providers where I felt safe, where I could really vocalize my desires, my motivations, my ambivalence, my ups and downs, like that space we were able to navigate a little easier, because I felt like I had the support to do whatever it was that I wanted to do. I didn't know until the day that she was born which way I was going to go, but I just wanted room and space to be able to make that decision for myself. And yes, no provider along the way could say, the risk is zero. They had the room and space to be transparent enough themselves to say, well, we don't know. I don't know, but this is what we do know. And that was beneficial, for both sides of that two-way street.
Olivia, what is donor milk, and is it safe? And then how can parents access it? Because we are also hearing about that.
Well, donor milk is when a mother pumps her milk and supplies it to, I think I touched on it with the formula shortage, but she pumps her milk and donates it either to a mother directly or to a milk bank. You ask if it's safe. There's two types of milk sharing, and one is informal and one is formal. The formal is considered safe, and it's through a milk bank where all the milk they get, they do testing, they do background checks on the people who are supplying them the milk. They pasteurize it and they make it so that it's safe. It's safe enough that hospitals use it in their neonatal intensive care units in lots of places. And then there's informal milk sharing, which is not considered safe by many. And that's like a mother to family or family to family milk sharing, where the mother pumps her milk, says, hey, I've been taking ibuprofen, I take a vitamin, I take something for my high cholesterol, and they self-disclose their information, and the person who is accepting the milk, or they have the choice to take that milk or not, but there is no testing, there's no pasteurization. I guess you could do it yourself, but so it's not considered safe. But that is also it tends to be an option for lots of people, especially because often they don't charge for it. Lots of times in milk banks, they could be for profit or nonprofit, and so you have to pay so much for the milk. Informal, they can charge as well, but it's usually cheaper and or free. So here in Wilmington, we have a group called the Port City Milk Ferry, and it is an informal milk sharing group where moms, there's no money allowed to be exchanged, and they can say, hey, here's some extra milk bags to restock your supply, but there's no money involved in that. So it can be safe, it could be unsafe, depends on what route you choose to go.
What I've just experienced from both of your responses, right? Cece just shared with us how important it was to have a provider that there's a built rapport, connectedness, and someone who respects your values and your decisions and is also well informed, in tune. And what you've just done, Olivia, was to provide a lot of valuable information that was not necessarily from what someone would consider, what I would say my conventional background from healthcare will be knowledgeable about. When you put those together, the heart and gut and the values and the resource-rich information into the same setting, and you give that to an individual, I think that community members and individuals is so empowering. And it makes a world of a difference for how people show up and are able to take care of themselves in a holistic way. And so I just want to take a moment to ask Cece, how do you see, or how have you acknowledged health being for you outside of, I would say, adhering to a medication regimen, when you can have those other other avenues of holistic means of therapy or measures being provided to you to reach your optimal level of health for yourself and your children? How do they make a difference for how you care for yourself and your family? Or have they made a difference from when you first entered the health field with your diagnosis of HIV?
So over time, I have definitely learned that I'm more than a viral load and I'm more than my status. So within that, I've learned HIV has taught me how to advocate for myself. And that's just one facet of my life. But I'm advocating for myself when I walk into the dentist's office, when I go seek care for my children and my parents. I've taken that skill to transcend, all areas of my life. If a provider is not asking questions, any provider, if you're not asking questions about like my whole me, how can you treat me in this one appointment? You my ID provider, maybe I'm not taking my medication this week or I've missed more doses. What is happening with you this week? What do you have going on? But sometimes not looking at the full person, you're just strictly just focused on this and this and this, not taking into consideration all of the other factors that may be going on. So I definitely I am a whole person with whole needs. HIV is just the aspect, just one thing of it. Motherhood is just one thing of it. Mental health services, but being able to have a provider that sees me as this whole person is life-changing. Because then you can refer me to services, you can refer me to the help that you may not be able to provide for me within this appointment, but you care enough and you are engaged enough and you understand enough that it's not just about this one appointment here. Like I don't know, I need more than that.
Exactly. Because just what yeah, and just what I'm saying, like even the information that Olivia is providing, um, I know that I don't know too many opportunities where I know myself and colleagues that would have had the foreknowledge that she just shared um, about donor milk or to have that conversation for those who are unable to breastfeed. And yeah, so um, one thing that I wanted to ask CC, were you counseled about adverse effects that maybe the baby may experience from antiviral medications in regards to breastfeeding?
Yes, and I'm grateful for my experience because how they had it set up, although it's like a touch and go, we're still figuring it out to perfect it. But I got introduced to the pediatrician around 28 weeks gestational age. So talking to her early, discussing the different drug regimens, this is what research says about this set of drugs, this is what this says, and after a while we see the children catch back up, just having it broken down to me and allowed to process that along, with the decision of whether or not what I was going to do. Yes. And it was still worth enough, I was willing to take that. But my little 19-month-old, you wouldn't be able to tell nothing. Like she is caught up on all the charts. She is just as intelligent and I don't know, such a joy. So yeah.
Thank you.
Olivia, where you was at? I needed you. And I love chocolate milk.
I was here.
Olivia, can you share with us any nutritional recommendations that you want our mothers to know in preparation for breastfeeding or during breastfeeding that would keep them healthy or give the best nutrition to their babies?
So breastfeeding moms need about 300 to 500 additional calories per day while breastfeeding. So it's recommended to have a balanced diet, fruits and vegetables and protein and fiber and all that. However, it's also not the end all. I hear a lot of moms say that they would rather give their babies formula because they don't feel like they have a healthy diet. They don't feel like they eat well enough to support a baby. And however, that's just not the case. Your body will take all the nutrients that your baby needs to thrive from your body and give it to them. There's mothers, worldwide who are malnourished and breastfeeding and doing so successfully. So that is not necessarily something that you should be worried about. Breast milk is always going to be better than the formula, its counterpart formula. However, if your baby is failing to meet milestones or growth standards set forth by the World Health Organization, and make sure you check those growth charts when you're at the pediatrician, and then there should be an evaluation done by the pediatrician and an IBCLC lactation consultant. And as far as drinking, you drink to thirst. I hear all the time, oh, I need to drink Under Armour or whatever, body armor, or coconut water. And it's like, and I need to force it on myself. You don't need to do that. Just drink to quench your thirst and try to drink water. And that's what's recommended.
All right. Olivia, someone asked, can non-Black females join the chocolate milk group?
No. No, I have it happen all the time. People trying to join, or but it's not for that. There are plenty of avenues for non-Black females to take. Just I'm in charge of lots of other groups that welcome everybody in. However, Chocolate Milk is a safe space for us to meet and talk and not have to explain ourselves and not have to witness all these things that I see in my other groups. So it is not for them. I've had Latina women try to join. Well, there's no groups for Mexican women, she said. And I was like, well, then start one. And that's how we did it. We didn't, you got to do your own thing and find out what works for you, because this is what works for us. And we're not going to compromise that to make you feel welcome, because you don't do that for us. So that's not why, but that's how I feel about it. So no, it's only for Black women, and it's not just for women, it's for families to come. We encourage children to come, partners, grandmas, everybody, because I really believe strongly that you do better with support from your entire family. It's not just you who need to know things, it's your whole family, especially those who are going to be around you often, so they can encourage you and support you and help you reach out for help when you need it.
Okay. So we're going to share an evaluation, a program evaluation form with our audience today. And while they are completing that, I'm going to give our panelists the opportunity to share any regional, national resources and to give any last moment comments or questions or any words of wisdom that we have not had the opportunity to. So I'll start with our dynamic CC.
I'm just so grateful to share space and to see how these things blend together, because although we might not share a diagnosis such as HIV, so many of the experiences overlap, and just having that grace and understanding from other members in the community. And thank you so much for your support. Thank you for opening up this space for a conversation that I think will benefit so many other people. So thank you once again, and everyone have a great weekend.
Well, thank you for being here, CC, and gracing us with your presence and taking out the time, because I know that you are busy and doing wonderful work for all of us.
Yes.
You are representing. And Miss Olivia.
I just want to say thank you to Cece for sharing all of this. It has given me more information to add to my toolbox and to help others, because a lot of this information I didn't know. And it's like you said, it's something that's really controversial and needs to be spread. The word needs to be spread about how we can support mothers living with HIV. So I'm really grateful to you for all of this. And as far as resources, we have Chocolate Milk of Wilmington. This is in Wilmington, North Carolina. We have Port City Breastfeeding Project, which I'm the chair of. I'm also a leader for the Litcha League, which is a nationwide group. And if you go to their website, I didn't provide that, but just type in the Litcha League and there are groups nationwide and cities all over the place. There's also like Breastfeeding USA. I say if you really have an issue, you need to call an IBCLC, and they are around, some not as prevalent as you'd hope, especially not Black IBCLCs. But then there's Rose, Black Mothers Breastfeeding Association. And if you really have any questions, you can always try to call your local hospital. Hopefully they'll give you some good information. But and the biggest one is WIC, Women, Infants, and Children, because they oftentimes have free lactation consultants and specialists or peer counselors on their staff. And they have been a very, very useful and wonderful tool. So keep them in mind whenever you have a baby or get pregnant.
Thank you. Thank you. So we're going to close out our webinar. I thank you all for being here. I'm going to ask our panelists to just stay on for a few more moments, and we're going to thank all of our audience, and please complete today's survey, and we look forward to you joining us again in the future. Hopefully we've been able to answer all of your questions. Olivia said, what are IBTLC?
IBCLCs, they are internationally board certified lactation consultants, and they are the gold standard of care for lactation for breastfeeding support. That's what I am, and they are innovative, and they have to have so much continuing education. And since the breastfeeding the science and the what am I looking for? The research is always ever evolving. It's one profession, pediatricians, they don't really have continuing education, especially with breastfeeding. So IBCLCs have that information, and they're able to give you support with the latest information in breastfeeding care.
Yeah. All right. Thank you so much.
Thank you.
Thank you everyone for such a great discussion surrounding HIV and breastfeeding and uplifting the experiential evidence base along with the research evidence base. I certainly learned a lot, and I hope those in the audience did as well. So thank you for attending. We encourage everyone to sign up for So Time and follow us on Facebook and Instagram for updates on upcoming webinars, and join our mailing list for future updates. Our next webinar is Surviving the Odds, Born with an HIV Diagnosis and Raising a Family of Her Own with Antoinette Jones on May 12th. So look out for registration this coming week. Additionally, every third Wednesday of the month, we hold a hybrid group meeting for Black women living with HIV from 5:30 to 6:30. I will put the contact information in the chat for those who are interested in attending. And then finally, we have our Seeds of Healing retreat coming up in September. So please fill out the application if you're interested in joining us for a weekend of workshops, connection, and community for Black cisgender women living with HIV. Thank you again, and I hope everyone has a lovely evening.